Hello, I'm Shelton Thomas. I am a retired cardiologist and I am a ruling elder at River Road Presbyterian Church. I've been retired for 6 years, so take that into consideration on anything that I see. When I was asked to speak about blessings of the heart, I said immediately yes, because I'm very zealous about talking about the heart. It's been I've practiced for 40 years involving cardiology before I retired. When the blessings of the heart, when I looked at my slideshow, most of my slideshows and talks that I've given over the years involve diseases of the heart, which aren't such a blessing sometimes. And so I've taken the liberty of defining a blessing of the heart as when it lets us fix it in a less anxious way. The heart is an amazing organ, but it has allowed us over the years to fix it. In my tenure in medicine, from very obnoxious things that we used to call surgery to now we can fix it and you can go home in a couple of hours. And it's truly a blessing. My agenda briefly will be the heart is indeed a great organ. You know that. The fact that you're awake, conscious, and listening to me means that it's doing its job. I'll give you some simple anatomy. I'll try not to get too bogged down in medical talk. Some of my slides are for medical students, family practitioners, nurses, and I'll hopefully just put out the salient features for things that may be of interest to you. Even though the heart's an amazing organ, things can go wrong with it. And as I said before, the blessings will be in the evolution of treatment that we have, and it truly is amazing. It's a great organ. The average American lives 78 years. Males about 76 years and females 81 years. And so the average in America is 78.5. NPR did something last week and they said it went up a little bit to 78.6. That's a big deal for the population. COVID, for the first time in anyone's life that's listening to this, it went down because of fentanyl overdoses and COVID killing people, but now it's getting back up good. The heart's amazing. If you make it to 65, you're going to make it to 82 statistically. And if you make it to 85, you're going to make it to 90. So the weak ones have been filtered out before you get to the old ones. If you get old, you've got a great chance if you're 90 to be 95. And that's just the way it works. Now, when looking, if your heart beats 70, 72 times a minute, which is about average, each year you get 36.8 million beats. And if you put that over 78.6 years, you get 2.9 billion heartbeats. And that's an amazing, God has designed an organ that will allow it to beat and generate its own electrical impulses at 2.9 billion beats over the lifetime. Certainly some people have problems with this and pacemakers are necessary. I will say that I am a plumber. I am not an electrician in the world of cardiology. Plumbers deal with blood flow. Electrophysiologists deal with electricity. And all of my patients when they'd walk in the room, they'd say, are you a plumber or an electrician? Because if you have a heart attack, you want a plumber. If you need a pacemaker, you want an electrician. And that's just little niches that we go to. The average heart pumps about 6.3 quarts per minute. That's 6 liters. Again, I'll do the math, and the average heart pumps about 65 million gallons of blood in a lifetime. I am not a truck driver, don't have a license and never driven one, but I am told that this truck holds about 11,000 gallons of fluid. So if someday that you walk in and your spouse says, gee, you look tired, you can say, I've been pumping blood. I pump enough blood in 4.8 days, I'll fill that truck with the amount of blood that you pump. And so each week you get about a truck and a half of volume pumped out. And that's truly an amazing thing. And that doesn't take running, exercising, getting angry, or going to sleep. That's just the way it is. And that's a fairly amazing organ. What I'd like to do now is, again, in order to understand some of the diseases, just some basic anatomy that's required to understand what's going on in the heart. If you were to open the chest, this is really what you would see. You'd see the heart sitting there just to the left of the sternum, and the arteries, these almost are like little tubes. They're more complex, and I'll speak to that in a second or so, but they run right on the surface of the heart. There's cardiologists are not very imaginative people. We call this one the right coronary artery because it's on the right side of the heart. We call this one the anterior descending because it's on the front of the heart. And we call this, the one on the left is the left circumflex. Circumflex is a little of an odd word. The back of the heart is supplied by a collection of all three of the arteries. The heart pumps blood, but it's its first customer. This is the aorta, the main blood vessel going to the heart. And these little arteries originate right at the beginning of the aorta. So while it pumps blood everywhere to your toes, to your brain, it makes sure it's its first customer. These arteries are how plumber cardiologists make a living, quite honestly, because a lot can go wrong with them. I'll speak to that in the ways that we fix it in a second or so. This is, if you slice across the heart, this is probably well known to you from your physical ed class or health classes in medical school. There's two chambers at the top. They're called atria. It's Latin plural. One is atrium. There's one on the right. There's one on the left. The two chambers at the bottom are called ventricles. The left ventricle pumps blood to your body. The right ventricle pumps blood to your lungs where it can get oxygenated. All the deoxygenated blood below the diaphragm comes up, goes to the right atrium, goes through this tricuspid valve to the right ventricle, and it's pumped to the lung through the pulmonary artery. Once it picks up oxygen, the lung is out here somewhere. Once it picks up oxygen, it comes back through the pulmonary vein, goes into the left atrium, through the mitral valve to the left ventricle, out the aortic valve, and it goes to all your body. This is your right arm, this is your left arm, and goes to your feet down through this, the aorta. I'll mention the valves because the two blessings of modern medicine that I'll discuss are how we can fix valves. The tricuspid valve on the right side, in 40 years of practice, I think I probably intervened on less than 10. That valve rarely goes bad. The pulmonic valve, I can tell you that I've never intervened on a pulmonic valve in 40 years. Pediatric cardiologists deal with that because sometimes people are born with defective, but adults almost never have disease in their pulmonic valve. Conversely, I've probably dealt with 1,000 mitral valves that went bad and about 1,000 aortic valves in the 40 years that go bad. So mitral valves, valves on the left side of the heart, are much more apt to cause misery than are the valves on the right side of the heart. The first disease I'll talk about briefly, and then I'll relate to how we can fix it so much better than we could when I started in 1975 in medical school. Atherosclerosis is a big, long, I think it's a Greek word. Basically, what it means is sludge, cholesterol sludge in your arteries. And that translates to heart attacks, as I'll explain in a second. Heart attacks are, I talked to 1,000 mitral valves I dealt with, 1,000 aortic valves I dealt with. I think when I counted 20,000 interventions on coronary arteries I did in the 40-year career. So these blocked arteries are much, much more common. This is an old slide. It's 1997, but it hadn't changed any. This is the mortality of women. And women were thought not to have heart disease as much as men. That isn't exactly true. But when you compare all the other diseases, lung cancer, emphysema, breast cancer, ovarian, diabetes, accidents, it is really trivial compared to clogged arteries, atherosclerosis. Cerebral vascular disease, for me, if you have a clogged artery in your brain, it's a stroke. If you have a clogged artery in your heart, it is a heart attack. They're very similar diseases. So for me, I like to lump cerebral vascular and heart together. And if you put these two together, I think the ratio is something like 8 deaths related to cardiovascular disease for every 1 related to cancer. And that's not to trivialize cancer diseases. It's certainly a misery as well. But the cardiovascular disease is America's leading cause, all first world country leading cause of death. This is a slide that I love. My wife doesn't love it. She thinks it's too scientific, but I will give you the reason that I show this sign. I'll give you the question that it answers so that you might want to pay attention without getting too bogged down in details. In 40 years of presentation, when I would talk to a spouse after we clean out an artery in somebody that was having a heart attack, and they go, "How could this be, doctor? He or she cut the grass and washed the car yesterday. Was he having symptoms and not telling it? Should I be angry at him for not telling me he had symptoms?" And the answer is in this slide, as I'll walk my way through it. When I said the arteries that run on the surface of the heart are tubes, that was oversimplification. This is a cartoon of an artery that's sliced open and then it's divided in segments. You're born here and you die here, and hopefully there's 95 good years in between. What I'll do is, again, without getting bogged down, the arteries have 3 layers. You can see right where the pointer is, it's the intima or endothelium. There's the media, that's a muscle, and this is called the adventitia. You can just think of it as 3 layers. It's a pipe with 3 layers. The endothelium is almost like a glass lining. Blood's running this way in the artery. This is the lumen, which is really the channel of a garden hose. And some of the early work done in the early 50s, when they started doing autopsies on people that were killed in Korea in the war, is they found in 20 and 30-year-olds, the arteries had little fatty streaks underneath. And they really weren't sure what they were. But now we know this is early atherosclerosis. Cholesterol, there's due to small damages in the inner lining, due to small damages in this inner lining, cholesterol can actually leak through. What causes that? High blood pressure, and that's almost a mechanical thing. It stretches that lining so the lining will get little breaks in it, and cholesterol can go and collect underneath the surface. It's slippery little stuff. Oxidized cholesterol is very slippery, and that's why antioxidants were thought to have a role at one point on keeping cholesterols from sticking to your arteries. But once this cholesterol gets between the intima and the media, the body very appropriately recognizes it as a foreign substance. And when foreign substances collect in places that they shouldn't be, what does the body do? It tries to get rid of it. This is a beautiful thing if it's a virus or if it's a bacteria. However, if it's cholesterol that's in between underneath the endothelial lining, it goes in and gobbles it up. But then that gobbled up cholesterol becomes what's called a foam cell. It's a big cell and it forms a glob. This glob I always call is a little bit of a pimple. When you're a young person, pimples ruin your life when you're going to the class dance. And when you're an old person, pimples underneath your arteries ruin your life because they create mischief. Part of the inflammation, and right now inflammation in cardiology is very, very big. Inflammation is when white cells are fighting a battle. That's what causes a fever when you're sick, or any sort of process where the body's fighting is inflammation. And now you see people, even on commercials on TV, people getting in ice baths, people drinking a lot of things to decrease inflammation in the body. But again, just going quickly through this story, the cholesterol keeps getting in and the white cells gobble it, and then calcium is reducing, part of the chemical reaction calcium is involved with. And so calcium gets deposited. And a lot of us, this is how you get hardening of the arteries. Literally at the time of surgery, your arteries here are like a soft rubber hose. When you get here and the calcium starts, you can really get it's a crunchy artery. And I say that very descriptively, that it's a crunchy artery when you feel it. And that's calcium that's deposited around these globules or pimples or collections. Medically, they're called plaques. Now, again, this patient, if you look, the lumen or the channel through this artery is never compromised. So the artery is perfectly able to transmit all the blood the heart needs. What happens, and this is how this patient is asymptomatic. These little plaques or vulnerable plaques or pimples or collections, they actually rupture. And when they rupture, the content is exposed to blood because there's blood here. And the content in this has a lot of chemicals that make it like super glue. And they're very, very sticky. And they cause all the platelets to stick together. And the platelets, if this happens, if this plaque ruptures and you get a little platelet sticking together, you might tell your spouse, that fish didn't agree with me. You know, I'll get some Malox or bicarbonate of soda. You might not recognize it. And I'm not saying it's very hard. Even doctors in the emergency rooms, it's hard to tell when you have a little bit. So your EKG can be perfectly normal, having some platelets stick together. If the platelets totally stick together and thrombose the artery, then no blood can get through. It's hard to ignore that this is a heart attack. This is called unstable angina, the beginning of a heart attack. And this is called, when I was in medical school, we spoke of heart attacks as being coronary thrombosis. And this is the coronary artery, and there's the thrombosis, and no blood gets through, and that is a heart attack. And if it's postulated that this happens, and then it heals, and then you get scars all along, and then the scars actually compromise the channel through the artery. This patient is asymptomatic. This patient is having severe chest pain. This patient, this happens in the lumen or the opening is very small, you can rest, you can sit on the couch very fine. But if you walk up a hill or run a race, that artery can't transfer enough blood and you have angina. So that's if everybody could, if we could figure this out in life, you'd probably get a Nobel Prize. This is basically what causes a heart attack. And again, as an interventional cardiologist, I only get involved in the last 4 stages. All the rest, they're asymptomatic. And that's why risk factor modification is so important. How can you slow this process down? That's treating hypertension and things that I'll mention a little bit more. But I think it's important to understand this slide because this is what causes a heart attack. You can be asymptomatic one day, have a heart attack because you have a vulnerable plaque. You have a plaque, it becomes vulnerable, ruptures, and causes the platelets to stick. This is why you chew 2 aspirin when you have chest pain. Again, another simpler, the 3 linings, you get a plaque underneath, the plaque grows, there's the gooey center, the pimple, it ruptures, you get some platelets, you get a little thrombosis, might be a small heart attack, and then you get a big heart attack right there because no blood goes through. And again, these are the arteries, I showed the right coronary artery, the front artery. And if you get a thrombus right there, no blood can get in this area. So this segment, this segment actually becomes a scar. And without oxygenated blood, that area will actually die and become a scar, a non-functioning heart. Now, when I started medical school, this was considered a beautiful thing. We could do bypasses. In the late 60s, literally they would take a vein, and if there was blockage there in the artery, they would bypass it just like 295 bypasses Richmond. There are different sorts of bypasses, and that's for medical students and family practices, and there are reasons to do, but we'll take an artery from your left subclavian internal mammary artery and attach it and we'll take a radial artery sometimes and do bypasses. But when I started medical school, we would do lots of bypass surgeries. For single vessels, we would do 1, 2 bypasses. In the last 35 years, we never did less than 4 bypasses. Single vessel bypasses are a thing of the past, quite honestly. But that's the way we dealt with it. This is a photograph of my late father-in-law. He had bypass very young in his age. I show his name. He's in heaven, but he's very proud. He loved it when I would show his diagrams and stuff. But this is a real world study. He had blockage. These are the arteries here. You can barely see them that he was born with. There's one over here as well, running down through there. And when he had blockage at a very early age, visiting our house when I was an intern many years ago, he was 50. We had to put bypasses on him because he had severe blockage. And the surgeons actually just cut a little hole in the aorta, take a vein and run it around the blockage. Very commonly done surgery then, less commonly now. When I was in 4th year in medical school, Andreas Grundrich, who was a cardiologist in Scandinavia, developed a procedure. He developed angioplasty, the balloon surgery. And this actually, for the first 15 years, there was just a plastic balloon, the metal cage I'll speak to earlier. We would go through the artery with a wire, just like it's a 14,000th of an inch, and slide a balloon over it and mash the cholesterol out of the way. And it was very good, very safe, and I did literally thousands of them. But the problem is it would come back. You would push it against the wall and it would come back. If you had 100 angioplasty patients, basically got to practice, because you would either do it, check for it coming back, and when it came back, you would do it again. In 1996, a couple of cardiologists actually they were in Brazil, did what's called stents. And now these stents are metal cages that you attach to a balloon, deflated, and you come and you blow up the balloon, and it mashes this scaffold and keeps the cholesterol plaque under the scaffold. And it cut the restenosis comeback rate, which is restenosis, from about 70%, 60 to 70%, down to about 5%. So it's a very, very effective way. Open heart surgery, you're in the hospital for 10 days. It's 4 weeks, you can't drive. We don't like for you to ride in a car, ideally, because of the seatbelt issue. And it's a good 12 weeks for your sternum to heal. With angioplasty, when I quit, we would do this. You'd stay in the cath lab for about an hour or two, and then you would go home. And the whole process has just truly been a blessing by anybody's standards. This is a stent. This is the fingertip. That's a stent that the balloon is blown up. And this is an undeployed stent. These are 3 or 4 millimeters in size. They're not very big. And so literally it's okay. Engineers are great. Those balloons could tolerate pressures 400 to 500 pounds per square inch without swelling up. Because if the balloon gets big, it'll burst the artery. Engineers in their genius could make a balloon go to a predetermined size and not expand. Unbelievable engineering. And you could see how these little stents, you could crimp them on a balloon and have it pretty small relative to some of the things that we do. And that's what the inside of the stent looks like. Why you have to take blood thinners. You can imagine that's a foreign substance inside the artery. And until that coats over, till the body naturally coats it over, it predisposes to platelet sticking. So you have to take blood thinners after you get stents. But that's sort of what it looks like. The next disease that I want to talk about is something that it's aortic stenosis. It's the aortic valve, and the aortic valve, unlike the smallness of the stent, this is 1.5 inches, maybe 1 3/4 inches in diameter. And the aortic valve has 3, these are called cusps, but they're basically just leaflets that open and shut. And they do that. How many times I said 3.2 billion every heartbeat, the aortic valve opens and shuts. What a miracle thing that it can take that much abuse. It does. you'll notice at the end of this, the aortic valve, just like you get wrinkles in your face and other places, your aortic valve gets some wrinkles. I've heard, and I don't know if it's the fact, that 120 years, everybody's aortic valve would wear out if you live to be 120 years old. It's sort of like car tires. If you put car tires on your car and keep it, you're going to wear the car tires out. If the aortic valve is really not a lot to keep it from not getting wrinkly other than die young, which is not a very good alternative. This is a valve called aortic stenosis that's severe. And you can see how that's really an impaired opening. It doesn't just squirting blood out of a pinhole versus the other ones that open a great deal and allow the blood to go to the body. This produces shortness, chest pain, and ultimately your demise. When I was in medical school, we considered it a blessing. Only in the late 60s did we routinely operate on those valves. Again, replacing one of those valves involved 10 days in the hospital, the sternum, the breastbone healing, 12 weeks of misery. My father, when he had open heart surgery, said 12 weeks was not enough, that it took him about 6 months before he totally became normal again and wasn't reminded routinely. About 3 years before I retired, we started, some genius started taking tubes from the groin, raising that we had crimped a valve on. And again, the heart valve's 2 inches in diameter, but they were able to fold that valve and crimp it inside a tube that was enough that it could be placed in your femoral artery in your groin and slid up to your heart. When we started doing this, the tube was as big as your thumb. So if you were a 5-foot person, your artery probably wasn't as big as your thumb or as big as my thumb. And so we could only do this on good sized people that had big enough arteries to allow us to get the tube up. I continue to watch films because it's hard to throw away 40 years of knowledge, but now they have one that's small, 3 millimeters, and they can put a valve through your radial artery, your hand artery, which is an amazing topic to me, considering that it started out being 28 French, and now they're applying for permits for an 8 French catheter, which is just very small. Once you get this large tube up, whatever size it is, you put it across that valve that's all calcified, rough, and not opening very well. Once you get it in place, because you don't get but one whack at it, once you get it in place, you pull this tube back, and then you blow up the balloon inside this 1.5 inch valve, and then you blow the balloon, let the balloon down, and you go home. And unlike the 10 days you're in the hospital, once you do this, this takes about 30 minutes to an hour to do. We kept them in the hospital overnight just because it's a pretty big hole in their femoral artery that needs to heal before you can go walking around. But we would let them go home in 2 days to resume normal activity. And if as you might have noted, this is a disease of elderly people. And so who wants to do open heart surgery on a 95-year-old that's got a bad valve? A 95-year-old could tolerate this procedure much easier than open heart surgery. And it's truly been a gift. And now I think they're doing more valves this way than they are operating at modern hospitals. I will say, notice how the heart muscle, you saw some cartoons, this heart muscle, because it's squirting blood out of that pinhole, just if you pick up weights, your arm muscle gets big. If your heart is squirting blood out of a pinhole, it gets thick. You might want big arm muscles, but you don't want a thick heart muscle because it's stiff and is associated with shortness of breath. I think TAVR has probably been the most miraculous thing that I've seen in my tenure in cardiology. People ask, what happens to this stiff valve, and you just bust it open and open it up, and it's trapped under the stent. For the risk of time, I'm going to go over this. I'll conclude with things that can help. How can you? God gives us a great organ, and he gives us ways to fix it. And he also gives us things that we can do to decrease the likelihood that you need a fix. I'll start at the bottom. Boy, you can't beat genetics. I always tell patients the best way to live a long, healthy, life is pick good parents. And if you can do that, it really is a gift. Atherosclerosis or cholesterol sludge is multifactorial. There's not one gene like sickle cell that you can pick and cure it. But maybe someday we'll be able to attack the genetics, but right now we can't. There is no medical disease that diabetes doesn't make worse. Diabetes is much more than just a blood sugar problem. It affects your eyes, your nerves, your kidneys, and your blood vessels. Diabetics probably have damage to that inner lining of their arteries more so, and that allows the cholesterol to go through and start that atherosclerotic plaque very early in your life. Richmond is the capital of cigarettes, and I think there's no debate now, is that tobacco smoke inhaled in your lungs is not good for you. It's multifactorial, but everybody knows that. Patients, I would tell that honestly, and most of my patients, some were very nice, intelligent people that continued to smoke after heart disease. And I said, it's your decision, but realize that it truly does aggravate the condition. High cholesterol. When I was at UVA in 1979, when I left, a cholesterol of 300 was considered normal. Now, that everybody would have a epileptic fit from that. It's so high. The cholesterol now, and in fact, when I was at UVA, when I was at medical school, when I graduated from medical school, we didn't know about good and bad cholesterol. We didn't have good therapy. We told people don't eat eggs back in that day, which probably wasn't a good advice, but don't eat bacon, don't eat fatty meats. And the therapy, even if you did all that, you could only get about a 5% drop in your cholesterol. Now the cholesterol level, the LDL during my tenure was, the goal was 160, then 130, then 90, then 70. And since Christmas, the American Heart Association has lowered the LDL level to be 50. And there's just no way you can starve to death and probably have an LDL greater than 50. It's really hard to achieve. That's why there's a lot of medicines. Statins are the ones that we use the most, and they're very effective. They aren't totally free. They were expensive, and some people experience muscle pain, but they're very effective in increasing your longevity and decreasing the likelihood of cholesterol sticking and building up in your arteries. High blood pressure damages the inner lining, and it also causes the blood vessels to get bigger, and that's not necessarily a good thing. Blood pressure, when I was in medical school, started it. It was, the blood pressure was said 100 plus your age. So if you were 80, 180 was considered normal blood pressure. That's not the truth. We truly want your blood pressure much lower than that. It was a reflection that your blood vessels got stiffer as you got older. But now, it is desirable to have your blood pressure 130 over 80 all the time. The problem with that is that sometimes the medicines are so effective, when you get out of bed, a warm bed at night to go to the bathroom, it'll fall too much and you'll faint. And so it's a fine line trying to keep your blood pressure in a good way. There's magic in activity. And I always say this, I'm certainly not a marathoner, I'm not a triathlete, and I drive past the gym every day on a regular basis. Some days I stop, often I don't. I think there was a study in 75 that said any activity is better than none. If you rolled your own wheelchair rather than have your wheelchair pushed, you did better. And so I tell people it doesn't have to be some zealous activity. It can be any form of activity. Obesity is a pandemic in America. I think 43% of Americans or by the definition that we've used for years, which may or may not be correct, people that are obese probably have more diabetes, they have higher cholesterol, and their blood pressure should be is usually higher as well. And because of some orthopedic infirmities, you often are more inactive too. And so that is a problem that needs to be addressed. Ozempic is there's a lot of talk about weight loss pharmacologic right now, and it seems to be very exciting. And the last, for women, we knew that men had heart attacks more than women until menopause. And menopause is basically your ovaries getting tired. And when your ovaries get tired, they quit producing estrogen. So for many years early in my practice, we gave estrogen like candy. Every postmenopausal woman got Premarin until it was actually studied. And in the early 90s, it was studied, and your estrogen made by your ovaries is good. Estrogen given to you by a doctor isn't. It didn't work for heart attacks. And so now we don't give it at all. My last slide is, despite the pessimism, I think we can fix the heart, and it's a blessing. This is a slide that starts in the year 1000. It was life expectancy. And they do it every 100 years. If I can move that, yeah. This is the 78.6 that I started with at the time that we currently are in. That life expectancy in the year 2000 was 25. That's not so impressive. Childbirth had a lot to do with that. That was pulling down. If you look even from 1000 all the way to 1800, when Thomas Jefferson was president, it went from 25 to 38. That's not such a good, successful life to me either. In the 1800s, the germ theory came prominent. So we started putting the toilets on one side of the house and the well on the other side of the house, and germs became less prevalent. In 1900, the most common cause of death in America right here was consumption, TB. Now TB is making a little of a comeback, but it's really a non-disease. Atherosclerosis has taken over. So despite diseases, I do think that a medicine is still doing very well, and I'm optimistic that we'll have exciting new ways to deal with stuff. And thank you. I think that's the end of my talk, and I enjoyed presenting it, and I hope you enjoyed hearing it. Thank you.